Right, let's start with this international story. The death toll from those two massive earthquakes in Turkey and Syria has now risen to over 2,300. Many more people are injured. The death toll is expected to rise. Rescue efforts, of course, continue. President Cyril Ramaphosa has just expressed his sadness at the losses. The global emergency response, however, has been swift. Local aid organisation Gift of the Givers has also decided to come to the assistance of the many thousands of people in distress. And I'm joined now by Gift of the Givers CEO, Director, Founder, Dr. Imtiaz Sooliman. Doctor, thank you so much for your time. I understand you spent a lot of the day in discussion with Turkish authorities here. What are you hearing about what it's like on the ground?
Good evening, Sally. They're telling me that this is the worst earthquake since 1939, the one they had in Erzincan. And they said the earthquake, when we spoke to them, and even the Turkish airline people, they were in tears. First of all, they were very grateful that we are responding. And secondly, they had the TV on in front of them and said, look at this, how people have passed on, how difficult it is. And then they said, look at the weather, the snow, the rain and the cold. It's very difficult to take the people out. We appreciate any support we can get from anywhere in the world, and we're very thankful for the people that are coming through from all parts of the world to assist us. We need all the help. We got two big earthquakes, one 7.8, the other one 7.5, but multiple aftershocks. And they said it's complicated because it's not in one city. It's in several cities, and they need to send the teams to several areas. They need search and rescue teams, urban medical teams, and equipment to assist. And they said they will be grateful for any assistance. They will facilitate all teams, equipment, everything. They will do everything, but they're grateful that teams are coming.
Talk to me about what Gift of the Givers is doing. I understand you're sending multiple teams to the area.
Yes. Remember that earthquake is in Turkey and in Syria. And in Syria, of course, we have one of the largest hospitals in the northwest of the region. Already 35 deceased people just came from some areas. And we've seen 173 casualties just from a small area. All the hospitals in that area and clinics are converted to emergency centers. So the death toll in Syria alone is also very huge, and the casualties are very high. We're augmenting support for our hospital teams there. In terms of Turkey itself, of course, we have a child care center in Gaziantep. The kids had to be evacuated when the tremors came. Fortunately, the building's not damaged and nobody was injured. But sadly, the brother of the founder members of the child care center that works with us is missing in a place called Hatay, where his building collapsed, and they can't find him at the moment. To deal with the situation, we're sending search and rescue teams. We've got the first 25 people ready to fly out tomorrow evening. The next that will be followed by medical teams. The next 35 medical team members are ready. And in addition to the first 25 search and rescue teams, we may put in another 15 to 20 search and rescue people, if not more, and even expand the medical team. We could send in between 60 and 100 personnel, depending what our teams find on the ground and how much more personnel are required, take into consideration and to account the teams that are coming in other parts of the world.
Now, you're a medical doctor as well as a humanitarian. Talk to me about how long someone might be able to survive under the rubble of an earthquake. Does the very cold weather make it does it increase or decrease the chance of survival?
Well, we've pulled out people from the earthquake in Haiti 8 days later. We've heard of 15, 17 days, 25 days, but those are very, very rare cases. People, depends how injured they are, how cold they get in the conditions. It's possible. The Turkish authorities are worried about the cold, that it's going to aggravate the situation, and people will perish because of hypothermia. And Turkey gets very, very cold, especially in those areas where the earthquake has taken place. It's anybody's guess what's going to happen and how it's going to happen. People perish immediately. People survive 3 days, 5 days, 7 days, 10 days, 15 days. That's all due to fate. But what's important is to get in as fast as possible, as with many teams as possible, to assist and get in quickly. We have special equipment that can locate life under the rubble. We've got video cameras that can see into the rubble. We've got sound, audio kind of machines that can hear sound even though there's noise on the outside. So we've got specialized equipment and hoping, but all the teams there, we'll try to save as many as we can. But the reality is that the death toll is going to be huge in this earthquake.
So are you saying that 2,300 it's going to be exponentially higher, do you believe?
Substantially more than that. Remember this morning it was 500. And, and of course, we haven't counted everybody. And in a situation like this, you're not spending time working on stats. All the stats haven't come in. People are worried about saving lives, not about counting bodies. So those stats will be probably accumulating far more than that. Nobody knows. The figures are going to be high. Just the amount of, and I've been to Turkey 28 times. The buildings are high. They're solid. They're full of concrete. If they collapse, it's going to be mass casualties. People are going to die, and the buildings are so close to each other. The populations are huge. And there's just too many people living in those areas. So the death toll is certainly going to be much higher than 2,300.
This is so tragic. As you say, you've been to Turkey many times, and you are going to be going back to Turkey as part of these rescue efforts. You told me just before we started the interview. There are a lot of other countries and a lot of other humanitarian organisations who are arriving to help, which is wonderful news in the sense that there are more people to try and rescue. But I would imagine it must require a great deal of coordination to make sure that all the areas are covered properly, that areas are not left out, that two teams don't arrive in the same area. How does it actually work on the ground?
Well, your success is dependent on the success of the organization of the country itself. And that's why we prefer working through the government. Turkey, the other thing they told me, they said, sadly, we've done this many times before. They've had numerous earthquakes, not as big as this one, and as big as the one in 1939. But they have earthquakes every now and then. So they said, sadly, we're quite used to this. We are ready for this. And when I spoke to the Turkish ambassador, she called Turkey in front of me. And there's an organization called AFAD, AFAD. They are the government's arm to handle disaster management. They got teams in Istanbul, and they even told us, we're going to fly you to Istanbul, but we can't tell you where you're going to go to from there next. So when you get there, the team in the airport will meet you from AFAD, and with Turkish Airlines, they'll decide whether you're going to Gaziantep, whether you're going to Adana, whether you're going to other places. We can't tell you because the situation is changing all the time. Mm-hmm. But what we can tell you is that you'll be received by our people in Istanbul and all those other places. They're emptying out hotels for the search and rescue teams to stay. They will guide you because they will have a list of where the highest density of people have been affected, which teams have gone where. And as she was talking to me, she said, this team is coming from Poland, that one from Ukraine, that one from Azerbaijan, that one from Belarus. And they said they're all coming in already. So we appreciate the teams. But the advantage is, to answer your question, is dependent on the country's management capability. And Turkey have done this before. So they are very organized in this kind of situation.
I wonder if you could give us a scope. You mentioned that there are lots of areas that have been affected. You know Turkey well. Could you explain to us the sort of pinpoint the areas that have been worst affected and the regions, and also into Syria?
Well, it's more in the south. I don't know the exact names. The names are complicated, but it's in the south of Turkey. It's on the border of Syria. It's not far from our hospital. And strangely enough, we had put up a second hospital on the border with Turkey, during the Syria war. And we now had to reopen that hospital because of the mass casualties coming in. So we had that, and my teams in Syria told me the earthquake came on the Turkish side and on the Syria side and caused damage on both sides on the south. Gaziantep is one of the main areas of entrance into Syria. The other place is Hatay, where there's an airport and damage. But there's 4 or 5 other names. I don't know the names exactly. It's very complicated. On the Turkish side, where they said the damage has been substantially high. My teams, the ladies that run the childcare center, said in our street we're fine in Gaziantep, but behind us in the village there's been lots of damage. Mm-hmm. And then they said in Gaziantep itself, 500 buildings have been affected. Wow. Now you take the amount of buildings, the amount of people in that one area only, and a similar amount of buildings in all other areas. Also, you can't get the stats because probably they haven't reached all the areas. It's snowing. And the guys said when we came out of our house, we had to wait 30 minutes or more to get back into the house because we were afraid of the tremors. But the snow was thick, the rain was heavy, it's freezing cold, it's difficult to move, the equipment can't go, teams can't go. It makes it very, very complicated. And they said that's going to hold us back, and we're probably going to lose the life because of those weather conditions.
Well, it certainly sounds extremely hazardous for the poor people who've been affected, but also the rescue teams as they go into those areas. It's not going to be an easy task. All strength to you and your organisation and the teams that are going to be on the ground in the next 24 hours or so. And thank you very much for speaking to us this evening. That's the head of the Gift of the Givers humanitarian organisation, Dr. Imtiaz Sooliman. The death toll is standing at now 2,300 plus. And Dr. Sooliman saying that he thinks it's going to sadly reach much higher than that.